Hi, I'm Dr. Chambers. I'm an OBGYN with Women's Care Florida. I've been here for 10 years, been practicing OBGYN for 14 though. So I wanted to touch on a couple of things that your OBGYN wants you to know. First things is that your first visit with your gynecologist does not have to include an exam. Sometimes this might be a first visit for a teenager, sometimes it may be a first visit for a woman in her 40s or 50s, and they might just want to feel comfortable. It may include sitting down and talking with your doctor without us having to actually examine you. The second thing your OBGYN wants you to know is that we really don't care about how things look down there. We want you to come in, we want you to feel comfortable with us. It's okay if you didn't get a chance to shave or wax. It's okay if you didn't get a pedicure. I'll compliment you on a pedicure, but you don't have to have one done. Our goal is to just make sure you're happy, you're healthy, and you're safe. We get that you're rushing sometimes. It is okay if things aren't perfect. The third thing I wanted to talk about is that your pelvic exam doesn't always include a Pap smear. A Pap smear is a part of a pelvic exam. Make sure to ask your doctor if they're doing a Pap smear that day. Pap smear specifically will check for things like HPV, but your doctor may not think it's necessary to have that checked that day. So just make sure you understand the difference. The fourth thing we want you to know is that your OBGYN is going to specialize in helping you to take care of your gynecological organs. Your OBGYN does not really function as your primary care doctor, and at some point might say, hey, you know what, I don't really know what's happening with your heart, let's maybe have you see a cardiologist. Don't get offended if your OBGYN does refer you out to a specific specialty, because we don't know all the things, but when it comes to gynecological organs, we certainly do. The fifth thing we want you to know is that you don't have to use fancy sprays, fancy perfumes. You don't have to buy these over-the-counter feminine hygiene products. A good bar of soap and some water 2 times per day is all you really need to keep yourself clean. If you do have concerns, then try not to mask them. That's probably the reason why you're here to see me anyways. So just wash, don't be concerned about anything else, because I can fix it for you if you're not happy with it. And the final thing your OBGYN wants you to know is that we want you to ask us all the questions. Do not feel uncomfortable regardless of the topic. I know certain things might be very intimate and that you don't really want to share, but that's why I'm here. Chances are I've heard it already 3 times today. So as much as it may be very, very nerve-wracking for you to come to the gynecologist, we want you to come. We want you to feel comfortable. We want you to feel open, asking any question, whatever it may be. We'll try our best to help you. If we can't help you, we'll find the person that can.